Good afternoon. Fellow Kenyans, 30 days ago, actually on July 27th, 2020, I did promise once again to appraise and, where necessary, to escalate or to de-escalate the steps taken so far to contain this COVID-19 pandemic. I promised to do so because most of the steps that we took were conditional. Whether they worked or not depended on how we responded to them individually and collectively as a nation and as a people. Well, today I'm happy to note that the majority of Kenyans have exercised a reasonable level of pandemic and civic responsibility in observing the COVID-19 protocols. They have embraced the fact that it is not enough for government to upscale its efforts if citizens also do not upscale their engagement as well. They understood that indeed a challenge like COVID-19 requires citizens to partner with their governments in finding solutions to contain such a challenge. And because of taking this challenge seriously, and more importantly, partnering with government, infections have gotten to a manageable level. In fact, we are reporting more recoveries in some instances than infections. Hotspots like Mombasa and Nairobi have begun to stabilize. Our health experts have indicated that levels of the positivity rate countrywide have fallen from a high of 13% in June to 8% in August. This is very encouraging, and it means that if we keep our civic responsibilities high, we have a chance to reach the 5% positivity rate recommended by the World Health Organization for a total reopening of our economy and country. In that regard, as at this morning, the confirmed COVID-19 cases have risen by 213, bringing the aggregate total so far to 33,016. We mourn the 5 lives lost over the last 24 hours, as we indeed mourn the lives of all those who have passed on as a result of this pandemic. Amid this tragedy, we are also remarkably thankful to God that we have, over the same period of 24 hours, recorded 241 recoveries, bringing our total number of recoveries to 19,296. So, fellow Kenyans, while we note the good progress that we have made so far in fighting this enemy, we must also acknowledge that this positive news is not a license for us to drop guard and backslide from our path of responsibility. Indeed, as I have mentioned in the past, we are fighting a war against an invisible enemy, and as we enter the 6th month of this war, we are also entering into a phase what is now being commonly referred to as the fog of war. In this phase, the combat arena is foggy. And in this fog war, the first instinct is that of self-preservation. You fight to propagate yourself, your family, and the environment that nurtures you. And in this foggy state, you also become aware that the government cannot police the daily activity nor the morality of every single individual citizen. In fact, in the fog of war, citizens, while maintaining their liberties, scramble first for survival. In sum, what will save us all in the war is exercise of civic responsibility. And I must emphasize here again that there are no unbearable responsibilities. In the face of a crisis like COVID-19, there are no unbearable responsibilities. And fellow Kenyans, let me make it clear when I talk about responsibility. I do not mean by responsibility who carries the burden, because responsibility is not a burden. It is a civic duty. Instead of seeing it as something you carry, we must seek it as a task, and a joyous one at that. It is a happy debt you pay to your fellow citizens for being a member of their community. The price you pay to propagate yourselves, your family, and your country. Fellow Kenyans, although we have done well in our attempt to flatten the curve, there are still two major challenges that have continued to stifle our efforts. First, while our determination to manage the spread of this pandemic in cities like Nairobi and Mombasa have started to pay visible dividends, this crisis has, however, begun to percolate to the counties. The new frontier of this invisible enemy is increasingly shifting to the counties and to our rural areas. Whereas there is no doubt that notable expansion of the health sector architecture has taken place in the counties, and for this I want to thank you, Governor Oparanya, and your colleagues. More needs to be done, and the pace of this expansion should be increased in order to cope with the gradual shift of this pandemic to the counties.